Lois Mohindo is one of several young people living with sickle cell disease. The 21-year-old lives in Kasese Cell, Mpumuro Ward, Maliba Town Council in Kasese District.
My dream was to become a health worker, but because of my condition, it has become difficult to pursue it.
3 of her younger siblings are also living with the disease. Godson Masereka, who is 16, and 12-year-old Jackson Thembo both experience painful episodes.
It feels like my joints are burning. Sometimes the pain in my bones is too much.
Mohindo's family has already lost 3 children to sickle cell disease. Godwin Baluko died at 16, Marion Bira passed away when she was 6 months old, and Raymond Liahinda died when he was 5 months old.
Sometimes I feel like the disease has taken away everything. It's painful to remember those we have lost.
Philemon Walina, Mohindo's father, says the journey to diagnosis and treatment has been emotionally and financially difficult. He further explains how the cold weather triggers complications.
We discovered the condition after going to Mulago Hospital. It was tough for the family, both financially and emotionally. Cold weather is the worst. It triggers complications. The children suffer more during rainy seasons.
Dr. Amon Bwambale, the district health officer for Kasese, says the region has recorded at least 10 deaths related to sickle cell disease in the past 8 months. Maliba Health Center 3, located about 3 kilometers from Hindo's home, is recording a growing number of positive cases for the sickle cell trait.
If we can do a massive test and we test the whole community of Maliba, we believe so many other people are still there that have actually remained there undetected.
You know, we can even screen people right away from birth. When they are delivered, there's a program we want to roll out where we can test you in infancy stage. At delivery, we take a sample and confirm whether you will be a sickler or not. We need to encourage that one in most of our antenatal clinics, in most of our delivery rooms, so that we can determine in time and tell you your child will be a sickler as early as infant stage.
St. Paul's Hospital in Kasese Town records an average of 3 new patients per day.
At the end of the month, you find you have 90 cases to 100 of sickle cell disease admitted in the hospital. The age range is from 6 months. Even adults, they go up to around, with the eldest case client admitted in the hospital has gone up to 25 years.
Dr. Samson Karabio, the hospital's medical director, calls on couples to undergo tests before they get married in order for them to understand the potential risk of passing the disease on to their children.
So once you find one of the couple is either a carrier or is a sickler, that's when you're supposed to stop from getting married, so that you can prevent sickle cell disease being transmitted to the next generation.
It's about 25% chances that if a sickle cell carrier who is a mother and a sickle cell carrier who is a father marry, then they have 50 chances of producing normal children, 25% chances of producing carrier children, and then 25% chances of producing a sickler.
Doctors Without Borders, MSF, estimate that about 0.3% of the population in Kasese District, which is roughly 2,580 people, live with sickle cell disease.
We have close to 350 sicklers that we are taking care of at Kasese Adolescent Center under Medicine Sans Frontiers. But we still believe that there are a lot of people that are not in care. That's why we should be aware of this disease, how it presents, and then we get screened early so that we can enroll them in treatment or care.
Sonny Israel, the MSF project coordinator for Kasese District, reiterates the need for awareness and advocacy at the community level.
The way sickle cell is perceived here is that it's contagious, and most of the parents have actually given their children to their grandparents to care. And the grandparents cannot care for these children better than the parents themselves. And so, most of them do not know that this illness can be treated.
For families like Mohindo's, the hope is that more awareness, early screening, and access to care can help ease the burden of living with the disease.